Man, woman, birth, death, infinity.
Good afternoon, and welcome to the Your Health television program here on AMP's Cable Channel 24 and on the internet at www.ampmedia.org. Join our rotating host and their informative guest live every Monday afternoon at 4 o'clock. The purpose of the Your Health television program is to help get, make, and keep listeners and viewers like you healthy. And now, ladies and gentlemen, on with the program.
Welcome to the Your Health television program hosted by the Monterey County Health Department. I'm Emily Sciolto, your host today and just about every third Monday of each month. I'd like to start off today's program by wishing all of our faithful and dedicated viewers a very happy and healthy new year. I'm raising my invisible glass on behalf of the Monterey County Health Department to say Happy New Year to you. We wish all Monterey County communities nothing but the best in 2013. Cheers. To be more specific, though, we wish all Monterey County residents high-quality health care opportunities, access to affordable, nutritious foods, and clean, safe drinking water. We wish safe communities free of crime and violence. We wish support for healthy development of children and adolescents, and so much more. As a matter of fact, these wishes will be the focus of our discussion today. Yes, indeed, the Monterey County Health Department wants to start the new year off right by making sure that you know how hard we are working to turn these wishes into reality. We're working to incorporate health in all policies. Health in all policies is a collaborative approach to improve health by incorporating health considerations into decision-making in all sectors and policy areas. This approach recognizes the links between housing, transportation, economic development, urban planning, and it's a unique opportunity for achieving healthier, more equitable communities. Today we'll hear from three guests who are all currently engaged in various parts of this collaborative approach. I'd like to welcome my first guest to the program, back to the program that is. Sitting across from me now is Dr. Krista Hanni, Program Manager of the Planning, Evaluation, and Policy Unit at the Monterey County Health Department. Welcome, Dr. Hanni, and thank you for being here.
Oh, thank you, Emily. It's really wonderful to have this opportunity to talk to you about health and all policies.
Excellent. But before we get into those details, we will be talking specifically about health and all policies in just a bit, but I want to kind of take a step back already here and set the scene for our viewers if we can. How did health and all policies come about? How did this notion or this concept come about?
Well, it actually goes back to first with the Board of Supervisors. Every year they do set strategic initiatives for the county, and within the Health and Human Services area of strategic initiatives, one of them in 2011 was to look at health outcomes in the county, to involve the community and stakeholders in that process, and then to use the information to inform the healthcare system delivery.
Okay, so it sounds like we did some planning at the health department.
Right. So when also in 2011 we had a new director, and he wanted to use that opportunity to work with, as directed, with Natividad Medical Center to do strategic planning. So by putting together information on health outcomes and then going out and talking to the community and getting their feedback on health issues was the beginning and the start of the strategic planning that led eventually to health and all policies.
Oh, okay. So tell me more about the strategic plan. We did this because we were directed, or the health department was directed by the board to work with Natividad, and that is why we did the strategic plan. What were the first steps that were taken in developing the plan?
So in order to put the plan together, we needed a planning team. And the planning team was made up of several of the health department staff, as well as staff from Natividad Medical Center. And it was chaired by two individuals from the health department, one which our viewers probably know very well, Dr. Lisa Hernandez, our health officer. At that time was our deputy health officer. And then also Erica Padilla Chavez, who will be speaking later, and was working in behavioral health at that time. And they led the process, brought the team together. The team was directed to seek community input And in discussing how to do that best, decided it would be great to go out to where community members were already meeting, routine meetings that were going on, whether it was parent-teacher meetings or school groups, other community organizations that might be meeting. And over the process of several months, the group went to about 21 meetings.
Wow.
Talking to about 500 different community members, and first presented on here's health outcomes, an analysis of health outcomes data for the county, and then broken down especially by region, if possible. And one of the areas we looked at was, for example, by region was premature death. And saw that there are differences by region, and also causes of death that show up that might not show up just in looking at mortality rates. And some of those causes, for example, homicide showing up as one in the top 4 for 3 of the regions, South County, Salinas, and North County, echoed again some of the concerns that the communities had for health issues as well as challenges. But we also talked with them about assets and then some of the solutions. And through these conversations, what we started to hear across the entire county, and when we analyzed the data and also compared it to some other assessments, what we heard in the themes that were coming out were very similar to some of the other assessments that had also occurred in the county. And those themes related to working for the health department to be working on some of the social determinants of health. So those would be what people might call also the root causes of health. So you'd mentioned, with health and all policies, transportation, jobs, housing. Those aren't areas where health departments traditionally have jurisdiction over.
Right.
Then we needed to look at what other health departments or other local health jurisdictions had done to work on the root causes. And that's where health and all policies began to appear as a potential strategy.
Oh, okay. So you had these community meetings, 21 of them, and they were located in all the regions of the county?
Correct. All the regions of the county, spread throughout the county.
And there was a team put together that kind of hosted and put these meetings on, and you looked at, you took their data, you took what they said, you analyzed that, and then you also utilized what other data you mentioned?
There were other assessments that had gone on in the previous few years before this. There's a maternal, child, and adolescent health assessment that had brought together a lot of stakeholders to determine the top health issues for maternal, child, and adolescent organizations to work on. And that had a lot of community or stakeholder input into it. There was also Building Healthy Communities had done a community input process that was very extensive for their planning. LULAC in Castroville had done a planning process. So there's just an example of a few of the assessments that we looked at.
Great. So you took a bunch of assessments, you took what they said, kind of boiled things down, and there are some commonalities. And from that, then what steps were taken at that point? So at this point, I'm thinking, okay, we did the meetings with the community. We have we've analyzed some other assessments. We've analyzed what they said. Then what happened?
So we created and wrote a strategic plan. That was a group document by the planning team, and we, out of the analysis that we did, came up with the 3 initiatives.
Okay.
So the 3 strategic initiatives are to enhance empower the community, enhance community safety, and ensure access to care, the 3 E's.
Oh, okay. Okay.
That helps us to remember it as well.
Okay.
And then we went back to as many of those community groups as possible to vet with them what we'd heard as those themes, as well as these 3 initiatives, if they resonated for them, and got very positive feedback from those groups that we did present to.
And I see how what you were mentioning earlier about some of the social determinants, the root causes, because the 3 E's that you just mentioned, only one of them, I believe, is directly healthcare related that I heard, right? Access to health, or access to healthcare, or ensuring access to healthcare.
Ensuring access to services and healthcare services, yes.
And so the other 2, I mean, I guess they're all very, social in nature as well, but I see what you mean by that. Social determinants, root causes in your initiatives. Those are root causes in the initiatives, right?
So then the strategic plan, they are the root causes, or they encompass aspects of the root causes. They also reflect many of the programs that may already be underway within the health department, but give direction for development of further programs.
Oh.
and strategies. And then the plan itself was taken to the Board of Supervisors and presented to them, and they approved it along with the recommendations that are in it. And the recommendations include taking a regional, well, the 3 initiatives, and then taking a regional approach, looking for opportunities to align resources, developing conduits of communication, involving the community, and then in developing a health and all policies approach.
Okay, so that's kind of how we got to, not necessarily where we are today, but that's why the strategic plan, and what came out of the strategic plan were the initiatives, recommendations, and other strategies that you mentioned. And this all kind of lays the groundwork for health and all policies.
This lays the groundwork for why health and all policies is one strategy to use as an overarching framework for some of the work to move forward.
I see. So tell me more about the community dialogue process as well. You mentioned you had meetings, and then you went back to groups.
Right. So we went back to the groups. So many of the groups were still meeting, and that allowed us to use the community leaders that we had touched base with in the first place to talk to them, to then find the next time they were meeting and then go present to them. So again, when we met with them, it was a dialogue process where usually there was a presentation, and then when we ended up talking with the groups, we might have broken up into small groups, and sometimes it was a whole group depending on how many people were there, and again asked and talked about assets. And many of the assets that were mentioned around the county are ones that people are familiar with, ranging from fire departments to libraries to even schools, of course, you know, where there are resources out there that we all utilize and consider as part of our community network. And then challenges were often people talked about were things such as safe walking on the streets, the lighting in parks, gang violence were concerns, or again, access to care, being able to get an appointment, being able to get 2 appointments, and having the opportunity to take advantage of buying organic fresh fruits and vegetables, because they can be very unaffordable for some people depending upon income. So then the solutions often came from that. And when we went back and presented to them these 3 initiatives, they could really see how they linked back to the solutions they talked about, such as helping with jobs, helping with transportation, helping with access, helping expand services in certain areas.
And then, so those are the initiatives. And then, how are the recommendations different? Because you mentioned that recommendations came out of the process as well.
So the recommendations are just a short list of potential means for carrying forward with the initiatives.
Okay.
And the one area that was listed as a strategy was health and all policies.
Oh, okay.
And then the other recommendations are maybe some potential conduits for doing that, opportunities for developing the stakeholder input in the whole process as it moves forward, or involvement.
And when you say conduit, what do you mean in this case? Just to clarify for viewers and things.
Sure. Well, it's part of communication. So how does the information go out and come back in? And it also might mean if there are or is the opportunity with that empowerment model to partner with community partners that work with the community to make sure that the information and the development of strategies or programs has that community input and involvement through the groups that are already out there.
Okay, I see.
And part of the community.
And I just want to kind of clarify that, because this health and all policies is a concept, as we talked about the other day. It's more of it's a conceptual type of approach, and so and I think it's somewhat new for people to hear.
It is. It is definitely a newer concept, and it's not used by a lot of health departments, but there has been some great progress using it that has been made by the few health departments that have made it, certainly in the understanding of how everyone can be involved in health and the opportunity for that community involvement in the process. I should also say, with the work that we did in Natividad involved, of course, this information could be used by them, and then with it going back to the Board of Supervisors, it gave them the information to see sort of that regional perspective and information from the community back to the supervisors.
It sounds very all-inclusive.
the approach definitely that Ray Bullock set up and wanted us to have was to have it as inclusive as possible. And that's, I think, also then led to some of the selection of the strategy for health and all policies.
I see. So what are the next steps for implementing the strategic plan and then, implementing the strategic plan, just moving forward with this?
So what we've done is formed an implementation team, which has some of the members that were on the planning team, but also other members from the health department. And that team is overseeing or acting in an advisory capacity for some of those next steps. We are wanting to talk to the local public health service providers and get their input on the service delivery that they are providing, and looking at that in relation to other forces that are out there that are probably going to play a big role in guiding or in impacting or creating changes in the public health system. Public health and health departments in general, for example, Affordable Care Act would be one that everyone would be very aware of. And then that would be rolled into the Community Health Improvement Plan, which will actually identify those gaps and the development of action plans for implementing services or programs to fill gaps.
So we're not quite at the action phase at this moment?
Not all of the action phase, but that said, because it does take a little bit of time to still collect a bit more of this information, that hasn't stopped the development of programs and plans that are falling underneath those three initiatives.
Okay.
So there's still a lot of work already going on, looking at outreach and engagement under Affordable Care Act, integrating, for example, behavioral health and clinic services are integrating service delivery at their respective clinics, so that primary care is now providing some services or will be providing services behavioral health is providing some services in primary care clinics. And that's part of that access to care. Under enhanced community safety, we received a grant from the Centers for Disease Control and Prevention for youth violence prevention. Of course, there's the work of the other members of the health department that are part of Communities Aligned for Safety and Peace in Salinas, which is a Salinas-specific strategy and team that works on that. And then there's many, many more programs that I could go on listing, but I think that just to assure the viewers that we will be identifying and still working on making sure that there aren't gaps out there that we can then move forward and prioritize further program development for. That's the next steps for implementation.
So the wheels are in motion, and you heard it here first, folks. Unfortunately, that's all the time we'll have for this segment, Dr. Hanni. I want to thank you again for talking with me today and providing our viewers with a really nice preview of some of the great health and life improvements to come in the future, near future, hopefully. If you'd like more information on the Health Department's strategic plan, please visit the Planning, Evaluation, and Policy Unit on the web at www.mtyhd.org/PEP. That's www.mtyhd.org/PEP. Well, right now we're going to take a short break, but don't touch that dial. We'll be back with more of the Your Health television program in just a moment.